my name is Ashley Speaker. I'm the program coordinator at Corporate College, a division of Cuyahoga Community College. And today we're going to talk about the Patient Access Specialist program that we have here at the college. I'm joined today by Tanya Williams-Smith, our instructor for the Patient Access Specialist. So thank you so much for being here today.
Thank you for having me. I appreciate it. Thank you.
Yeah, I'm so excited to talk to you about this program. We've had it for a little while here at the college, but also some of the changes we've made, such as going virtual with it. Could I just ask you a little bit about your background? If you could tell us about your background along this career path and how you found yourself in it?
Okay. Well, I started off as a medical assistant where I've obtained a medical assistant degree from Birmingham College. After then, I started doing a little bit of STNA work. That lasted for about a year. I did find employment with university hospitals where I can utilize my medical assistants, actually the front office duties. And my skills there led me on to different positions at university hospitals. And over the years, I was a trainer. I also ended up working as a financial counselor, which I love. I obtained my bachelor's degree in health administration and business management from Phoenix. I took those classes on campus in the Beechwood location. And from there, I moved on to my master's degree in clinical mental health counseling. And during that time period, I started working with Tracy as a trainer for the Patient Access Specialist program. And I really think it's a great program for the students.
It sounds like you've had a lot of different tastes of different areas too along the way.
I did.
Yeah, so it gives you a diverse approach to teaching
Mhm.
for us as well. When we talk about the patient access specialist, the first question that comes to mind is, what is it? What exactly is a patient access specialist?
As a person, a representative being able to assist the clinical environment that they're in, as far as like scheduling appointments, patient registration, obtaining demographic information, helping with orders, billing, charge entry. So they have many different faces. It depends on the department that you're in, the position that you hold. I think it's a wonderful. It's never a dull moment in that position. So it depends where you are and what that department demands from you.
Yeah, wow. It sounds like it's a wide variety of things that you would do on the day to day.
Mhm.
And also, that sounds like maybe the individual that I would interact with as if I go to the doctor, at the front desk or maybe even on the phone with calling about for information.
Mhm. Yeah, so they start from the beginning of that phone call or that walk-in appointment all the way through to the very end with your charge entry, your billing, and your discharge from the office as well. So it's from beginning to end. And like I stated, there are so many different facets and mechanics involved in that position. It's never a dull moment. You're always learning. You always have an opportunity to learn even more, which is a great thing because you don't have to just stay within one position or stay within one office setting. It's always evolving. So I believe that's a great thing.
What was your favorite thing with working in those positions before you became an instructor?
Hmm. Patience. I love my patients. I really enjoyed working in the Department of Medicine and working with the elderly. I love them. They are just too funny. I like working with the staff too. I believe teamwork is key. Teamwork makes the dream work. Without having teamwork, your department it's crippled. With teamwork, you just increase productivity. You can create a positive working environment, and the patients are always happy when you have happy workers there. And it's just a wonderful thing because you want to increase patient satisfaction. And I believe that's the goal with every hospital system across the border. It's a wonderful thing being a patient access service representative or a patient access specialist because you play a major part in helping someone else. You make their experience better. So that patient experience is much better opposed to you coming in and you don't have that warm welcoming and being able to provide that to a patient. I believe that's key.
What an important role that we can't take for granted, right?
Exactly.
What has been maybe something that surprised you about this career or challenging about this career as you've kind of worked in different aspects of the medical field?
When COVID-19 struck, the
That's a pretty big one.
that was a shell shock. I was just like, wow, what are we going to do? And then when they changed from the face to face setting to the virtual classrooms, I was wondering, how are we going to expedite this? How can you keep the students engaged? And um, they're engaged, they're focused. I think they like it a little bit more because they don't have to actually leave the comfort of their home. They love it. I love it, and it's working. At first, I didn't know how we were going to get through it, but with time, organization, and patience, we made it. We made it.
That's awesome. And what a good point. I mean, when you're talking about the class that we offer and how it transitioned from this face to face, in person, you're able to just really talk to the students so directly. And all of a sudden, you're taking this and you're putting it in this virtual environment. And how does that look? And the fears of the unknown. And are you going to connect? And yet, what you're saying is all that's still happening. Students are still talking, they're doing the work, they're learning, you're getting to engage with them, you share stories, those different things that really help build them as they move towards that career. I imagine it's similar in the industry and the hospitals as well, as they look to move appointments to online and be virtual now.
Some of the patients are okay with it. As I stated before, I am a hospital employee. Some of them are okay with it, and then the other ones, they are not. They would rather that hands-on because it does remove the personal feel. And now
Mm-hmm.
it's more so, it's teletherapy, and they're like, but then you have the other ones, they're very comfortable with it because they don't want to be exposed to the COVID-19. So I guess to each is their own. And right now we have to abide by the rules, and that is to keep us safe. So yes.
With this type of role, this patient access specialist, and kind of being that person on the front lines, but also doing a lot of administrative stuff behind the scenes too. You mentioned billing and different things. Are there any specific skill sets that an individual would want to have, or even just personality characteristics that you might see in someone and go, oh, they might be good for interacting with people or for staying organized?
Mhm. Confidence, being able to have confidence, and knowing your workload is key. If you go into an environment where you don't understand what's going on, you don't understand the mechanics and the flows of the department, you become stressed out. Your anxieties will be on a total high, and you won't be productive. If you go into an environment knowing what it is that you need to know and being able to perform with confidence, it's just paramount. And working with these students that I have, I can't tell you how happy I am with them. Their testing is just like, I'm like, who are these people? They are awesome, and they want to learn. So if you get an employee that's eager to learn and not afraid of change, and they're confident in their skills, oh my goodness, the sky is the limit. There is just wonderful. But when they don't have that confidence, they don't have that heart or that zeal for that position, it can be very difficult for them to work in that environment.
Hmm.
So I
Yeah.
hope I answered your question, did it?
I think so. I mean, you want someone who is really willing to be on the front lines, right? And work with people and be excited about it. And then that learning piece, like you mentioned, there's so many different aspects to this career field. So, certain offices probably are going to look a little bit different in what your role is fully as a patient access specialist. At the end of the day, you're on the front lines working with people, but there's going to be a lot of different environments that you could get thrown into. What was your biggest challenge along the way? Or I'm sure there's been different challenges along the way, but has there been something that was a standout moment that you felt like, I really learned a lot from that experience? It maybe even was uncomfortable at the time, but I really, ended up at the end of the day learning a lot and taking that knowledge with me and able to share it with students now that you're an instructor.
I had to work in the Department of Pediatrics, and I found out that that was just not my place to be. I had to, because it's not easy, changing from one position to another. You have to actually, in most facilities, stay within that position for at least 6 months. So I had a lot of changing to do. I had a lot of time to try to accept things, organize, prioritize, and learn to be a little bit more understanding, see things with an open eye.
Mm.
I did learn a lot in that department. Patience, being able to put myself on the other side of that desk um, is key. Showing empathy, being able to okay, I don't to put it in correct words is a little bit difficult when you find yourself amongst like children that's screaming.
Mm.
The parents, you may feel like they're not being attentive to the children, and I had to pull myself away from what my norm and try to be a little bit more understanding, if that makes sense. It was kind of difficult for me, as you can see, but I did learn. I had to understand that I didn't know what that parent was actually going through prior to her coming in there. That child could have had a fever or sick all night, and the parent she was just tired and just could no longer deal with the patient. So I learned to be patient. I learned to be more considerate than I've ever have before in that department, and it turned out to be a good position. I learned a lot that I carried on to other positions, and I try to share with my students. You have to see things with an open eye. You have to be understanding. You can't be judgmental. You can't be biased. And you will be able to perform in your position if you learn how to be empathetic.
Wow. And that's a really powerful lesson to learn. And I think we all learned it in our careers in different ways. And, some lessons are hard and fast, and some take a little while. One piece that you mentioned in that was the fact that there's so many different departments to work
Mhm.
in. So, you mentioned, you ended up in pediatrics and you had to stay in a position maybe for 6 months before you could really transition.
Mhm.
That's a great thing for people to know too. I would think that when you enter this field, there's a whole bunch of possibilities and paths you could go into, and a whole bunch of different areas of whether it's different medicine offices, specific pediatrics, or just general practitioners, but then also the more specialists, the rheumatologists and the endocrinologists and all those different, they all have patient access specialists probably for their offices, right?
I do. I actually, when I started in the department of admitting, I started off as a charge entry clerk. I was cross trained in the emergency department as a patient service representative, like a registrar. So doing those positions, and they liked my work ethic. Next thing I know, I was cross trained for central registration, bed assignment,
Wow.
check in. So I was cross trained in so many different areas that I was able to fill in a seat when someone else called off. I had the ability to be flexible like that, which is great because then you have a it's like you feel like, okay, I got a good job. I'm not worried about being laid off or anything like that because I can work this area, I can work that area. I'm comfortable working this one as well, and I was so confident. Next thing you know, they promoted me to being a pre-cert specialist.
Oh,
Moved
wow.
there, and I was offered a position to work in financial counseling, which I never really left. I'm still there, and I still cross train new staff. So I really love being able to get out there and learn new things. I never stop learning. So if I see something else out there and I'm like, oh, can I take that class? Because, a lot of the facilities, they offer different classes just so they can further your education. Not just that, but give you that confidence that you need so that you can work in a productive manner.
I think that's a really good point too, that like once you're in the field, you can just continually learn, right? There's opportunities to further your education. And, for you, that was a great thing to keep you going up and where you wanted to be, even, probably things you didn't even think about, like, going into it, whether you'd be a financial advisor one day, right?
I love it. I actually work now with cancer patients, and
Oh,
I look
wow.
for funding for them to help them with their chemotherapy. As you know, it can be very expensive. The patients, they end up falling into financial toxicity, and it's which something you would not want to be in. And again, you need to be empathetic. Put yourself in someone else's shoes, and you will learn how to treat people better because you want people to treat you better. I truly enjoy walking into that room saying, I found you $25,000 to go towards your treatment.
Wow.
Or I found a funding foundation that's willing to pay for your drug that was denied by your insurance company. So you can now have this medication that's going to give you a better quality of life. So, with that being said, you learn. You're always learning, and you're always reaching to find more ways to be educated. And with being with that, I've gained so much confidence. So I know when I go into work, I'm ready. Let's see what I got in store for me today.
And to see that you're helping people in so many different ways along this career path too, going from just being that welcoming face at the desk to being able to help find monetary assistance for them, which is, a huge piece of the stress when you're dealing with any type of medical condition. The last thing you want to think about is, can I pay for it? Right. This has been a great conversation. I always learn a lot along the way. So I just want to thank you so much, Tanya, for speaking with us and sharing a little piece of your story about this career field, and a little bit about how, we've transitioned into this virtual training for the patient access specialist. So thank
Thank
you so
you.
much for being here.
Thank you. I appreciate it.
Yeah. All right. Well, I'm Ashley Speaker from Corporate College at Cuyahoga Community College, and we were here today talking about our patient access specialist program. Please visit the link in the text to check out that program. And if you have any more questions, please feel free to reach out. All right. Thank you.